Our surveys have been live for about 6 weeks now, certainly the baseline, so we thought it would be interesting to look at where people were responding from. The table on the left shows the normal distribution of the population in the UK, so 8.4% of the UK is based in Scotland. In our survey, you can see 7.5% of people from Scotland have responded, compared to the normal registered population. This represents quite a good distribution of people across the UK responding to surveys. If you look at the 3 surveys that we now have live via the MS Register, there is the initial survey or the baseline, the confirmed suspected or the not suspected coronavirus responses. When you first visit, you get the initial survey, and depending on how you answer, 2 weeks later you'll have received one of the other 2. 4,169 people have now responded to the baseline or the initial survey, up from 3,600 2 weeks ago. 195 have responded to confirmed suspected, and 2,185 are in the not suspected category, up from 1,353 2 weeks ago. We will of course be sending out more emails shortly to update all these surveys. When we look at the population that have confirmed coronavirus, it's still only 1% of the overall population of people responding to these surveys. If we look at who has answered based on their MS type, you can see secondary progressive, relapsing remitting, primary progressive, and other types of MS. And these proportions are the same as we'd expect to see in the overall MS register. We have tried to find out what medical professionals are being sought for information. So this ranges from my GP contacted me with quite a low response, right up to I contacted my MS nurse with quite a high response. MS nurses appear twice here, as MS nurses contacting people is also quite a high response rate. The whole UK population has changed its behaviour since the outbreak of this pandemic. If we look at those people who do not have COVID-19, you can see people are I'm still travelling to work is by far the lowest response, up to I talk to people while more than 2 metres away is the highest. Again, this is in line with our behaviour since lockdown began. In the confirmed population, people that have answered that survey, if we look at the symptoms people are reporting, new or worse fatigue is by far the most reported symptom, possibly slightly not surprising in an MS population where fatigue is such a present symptom for people to have, but it's definitely the highest reported symptom, followed rapidly by cough and headache, all the way down as far as stomachache being the lowest reported symptom. This is very much in what we're seeing in the coronavirus response as a whole. A proportion of people with MS are taking disease-modifying therapies, DMTs, and it is interesting to look at this group. So 1,104 people are not on disease-modifying therapies in the no diagnosis of COVID survey. 980 people are on DMTs, but their behaviour hasn't changed, and 96 behaviour has changed, and this could be for a variety of reasons. Almost certainly not directly related to coronavirus. Well, I hope you found that interesting to look at some of the data we've been capturing and my little explanations as to what's been going on. The take-homes from this, beyond the message I gave at the start, where it looks like people with MS aren't at any more risk than the normal population, are that we now have 4,169 people who've responded to the baseline, 194 people with confirmed coronavirus, 8 of these by test, 184 confirmed by healthcare professional, and of these 6 were admitted to hospital. Thanks for your attention. Any questions, please leave them in the comments and we'll try and address them in the next video. Thanks for listening.